This is Core Conversations with Natalie Baggio.
Welcome to Core Conversations. I'm Natalie Baggio. Every day, decisions are made in hospitals that impact the care of our community. My guest today is Dr. John Froggatt, our Vice President of Medical Affairs and Infectious Disease Physician. He is going to share with us today his insights into how some of those decisions are made in areas that we're really proud of for our community. Welcome, Dr. Froggatt.
Thank you.
Thank you for joining us today.
My pleasure.
How long have you lived and practiced here in Southwest Michigan?
I'm in my 27th year.
So you've seen a lot.
Yes.
And you've seen healthcare evolve in many different ways.
Indeed.
And you've led a lot of different physicians into practice in different ways and into leadership roles.
Mm-hmm.
So I'm excited for you to share today with our community what is one change or improvement in clinical care that Corewell Health that you think our community will be most surprised to learn about.
I think one of the most exciting things that we're about to start next month is a new clinical service that traditionally has been offered mostly at larger medical centers, which is to be able to treat strokes in a new way. One of the most common causes of strokes is when a blood vessel in the brain is blocked by a clot. So this new procedure is a way of introducing a tiny device right into the blood vessel and removing the clot physically. And when you can do that, you can really get to very good outcomes because you're rapidly able to restore blood flow to the area of the brain that was affected. There is a very sort of limited time window in which you can do that before damage becomes longer lasting. And so to be able to now start to do that here locally, rather than to have delays in patients seeking these procedures, having to go outside the community and perhaps losing the opportunity for it to be effective, will have a significant impact on improving the outcomes for stroke in our community. So we're just really excited to be able to get that started next month.
Yes, that is a great example. And we're proud of this work because it keeps care close to home.
Yes.
And also it saves lives. And
Right.
Stroke is something that is time sensitive. And having the right healthcare professionals here locally is really something for us to be proud of. So
Yeah.
Thank you for your leadership and making that service available.
Very excited to be able to start that.
So just looking back over the last few months, what is a story that you could share with the community of a patient that you interacted with or that reminded you why your work is so important?
So I guess one of the examples that comes to mind is our care of patients with sickle cell disease, and specifically those folks who develop acute painful episodes of that disease. And they have to be able to receive medications in the community, but also to come into the hospital and get care. And we struggled for years in getting that right in terms of really establishing clear standards of durations of different interventions and things like that. And over the last year or so, we've been able to partner with a team from across the entire Corewell Health system to start to really develop and articulate standards and new processes for that care. And those have been deployed now across the entire Corewell Health system, including here locally. As part of that work, we were able to access experts in academic medical centers in a few places in the United States to really learn what is the current state of the art there. And so as we've been able to do that, we've realized really amazing improvements in that care with reduced times people have to be in the hospital, reduced numbers of emergency room visits, and new access to new processes and care outside of the hospital to be able to more effectively treat the conditions that arise. So after, again, having been here many years and struggled with that care for so long, it's just been so rewarding to see these improvements through a collaborative effort that really was much greater than just happening here, but we were a part of that, and now we're realizing the benefits of that. So that's just really exciting.
Yeah, that's great that we're not just impacting our patients here in Southwest Michigan. We're able to look at the entire state.
Right.
And having patients be able to stay in their homes longer and have more therapeutic treatment
Right.
that has a longer duration is a big win for our community. And I just love in return that it helps reduce the total cost of care for our patients and community. So that's,
One of the sort of personal, moments where this kind of really hits you is we had one of the patients suffering with that disease who was really struggling coming into the hospital, really having a tough time managing that, and upset enough that there were, struggles arising in the course of care. And through these new systems, and particularly with the new connections to outpatient care, she was able to really kind of change her whole approach to managing her disease, with the effect that she is now happy and coming back to us saying, this has really changed my life. I'm really able to live in a much, better way than I could before. So to have somebody come to you and say that is just incredibly rewarding.
Yeah, it validates the work and the effort when
Right.
it translates into a patient experience and outcome.
Right,
Yeah.
right.
Excellent. Thank you for sharing that. So what is something that you're most proud of in your work today?
So I think in general, as a physician, I have a lot of rewarding times as I help people with diseases, to be able to work on treatment plans and come up with diagnostics and things. And so to see that the benefits that somebody can obtain from that, and just the sense of being able to help them feel cared for as we work through the process together, that's very rewarding always as a physician. But I think in this stage of my career, equally or even more so, I enjoy building teams of physicians and other providers in different areas of specialty to really have healthy teams that are high performing, so the level of quality goes up and up, and to be able to have a team where every single member of that team is somebody that I'm happy to have my own family members be taken care of by. When I can achieve that, that's just enormously satisfying. And then at the same time, hand in hand with that, if I can build that team in such a way that the members of the team enjoy coming to work every day, that they feel taken care of and part of something that they enjoy being a part of, that's just really, really rewarding. So I think that would be the two things.
Yeah, so I think as you're pointing out, like cultivating a strong culture, what people feel connected to, and also a community.
Right.
I mean, someone like yourself who's lived here over 20 years and provided care here, you have to inspire the next generations to invest their time into the communities here in Southwest Michigan.
Yes.
So thank you for leading those efforts.
It's my pleasure.
So in 20 seconds, what is one thing you'd want to leave the community with knowing about?
So I think one of the things that we're always working on in healthcare is to improve our quality. Healthcare is very complicated. Many people are doing many things all at once to try to work with patients. And so I think one of the encouraging things is that we are becoming more and more sophisticated in how we measure and drive quality improvement. And that includes, new technologies, AI, artificial intelligence, but also just building new processes to try to more and more bake into our basic care processes important aspects that enhance and improve quality. So that's something that I think we're really happy to see moving forward.
Yeah, that's exciting. I mean, a lot of new innovations on the horizon and incorporating that into care, which in return will lead to better outcomes for our patients and community.
Right. Yeah.
Well, thank you for joining me. This has been a great conversation.
Thank you.
Yeah. Thank you. That's Core Conversations today with Natalie Baggio.